Hi everyone, good afternoon. Thank you for being here with us today. We are back at Doctors Go Live on Columbia Asia Facebook, and today we have a very interesting topic. It is regarding tonsillectomy. Okay, in layman's term, that is tonsil surgery. So to explain about this, we have with us Dr. Azlina Saaban, who is the consultant ENT surgeon at Columbia Asia Hospital, Cheras. Hello, Doctor. Assalamualaikum. Apa khabar?
Waalaikumsalam warahmatullahi baik, alhamdulillah.
Good to see you. Manis je doktor petang ni. InsyaAllah. Okay, doctor. So today we're going to be talking about tonsils. Maybe we can start off by you explaining exactly what is tonsil and what is its role in the human body.
Okay. Actually, tonsil is a lymphoid tissue. So our body have a lot of lymphoid tissues, including the tonsils, the lymph node, and the tonsil. We have 4 types of tonsils, which is palatine tonsils. The tonsil is at the, as we can see at the picture there, that is palatine tonsils. Pharyngeal tonsil is the adenoid, which is at the back of the nose, and others like tubal tonsils at the side of the, is actually at the back of the nose as well, but at towards the side, and also the lingual tonsil, which is at the tongue base. So
it's at the back of the nose, you were saying. What is lymphoid tissue? What is lymphoid tissue?
Lymphoid tissue is just that it is a type of the cells. It's a type of the tissue of the tonsil. It is lymphoid tissue.
Okay.
So basically, pardon?
Is it soft? I mean, how would you describe lymphoid tissue though? Is it
it's a rubbery. It depends. It's a soft rubbery in texture, and the function of this lymphoid tissue is for defense mechanism, basically to help to prevent our body from getting infection. But of course, the lymphoid tissue itself can also get infected. See? That's why we remove the tonsil if it is having problem, means like recurring infection or what.
Okay. Can someone, are you able to see tonsils if you just open your mouth and if you look in the mirror, nampak tak tonsils?
It depends. If you can, you open wide and then you say, maybe you say something like that. When the tongue base is going down, so then you can see the tonsils.
Oh, I see. Okay, because usually when you open your mouth wide, you see this macam something that is hanging, kan? It's like suspended on the roof of your mouth.
Is uvula. No, that one is uvula. This is at the center there. This is uvula. The tonsil is at the side there. At the side, the two, right and left.
Sepasang.
Sepasang. So other tonsils, like lingual tonsils, adenoid, all cannot see. You cannot see yourself, lah. Means doctor can see by doing scopes or what.
Yeah. Okay. All right. So 2 tonsils, and the function is to defend the body and
as a defense mechanism, because it produces something like antibody, something like that. But not to worry, because we have a lot, you see. So when we remove the tonsil, then no problem with the antibody in our body.
Oh, it will come from other parts of the body lah. It doesn't. It's not just tonsil, kan? Okay. All right. Okay.
So
all right, for this doctor, now you have already explained what is tonsils, kan? So now that we know what tonsils do, and then you were saying that just now ada chances that tonsils might be infected. So there are common conditions ataupun diseases, I understand. Perhaps you can just run through what are the common occurrences related to tonsils that you have seen.
Actually, tonsillitis is quite common. Even in GPs also, I think they also frequently see patients with tonsillitis, infection of these tonsils. So
are we looking at tonsillitis now?
Yeah, now I mean the picture is on tonsillitis, infection of the tonsils. So basically, so actually there's indication now I'm talking about the indication for the tonsillectomy. So one
indication,
of
the doctor. What do you mean indication?
Indication
What is
means
that indication?
when do we need to do tonsillectomy? I mean in what
Reasons.
condition we remove the tonsil.
Okay. All right. Okay.
So because if the tonsil is healthy, everybody has tonsils. If the tonsil is healthy, definitely we not need to do anything to the tonsils. But if the patient is having tonsillitis, mean infection of the tonsils, and it recurrence. Recurrence means actually in textbook it says 5 times a year in 2 years time. In duration of 2 years, you have like every 2-3 months you have that infection. So that condition we will suggest for the patient to do tonsillectomy. But sometimes the patient can't really wait. You see, sometimes because the symptoms of the tonsils like fever, very bad sore throat, and then with generous body ache, with the lymph node tender. So sometimes patient like already maybe 3-4 times request for the tonsillectomy, but it depends. Depends how the patient. But stated in the textbook, if 2 years, 5 times per year, we will suggest for the operation.
Okay. Alright. So what are we looking at now, doctor? Yang ada macam, it looks like nanah inside tu, macam it looks like pus. Like
that is actually the I mean the crypts. Actually tonsils contain crypts at the surface. Crypts mean like macam liang-liang kan. Liang-liang. So when the tonsil infected, so dia jadi besar and there's some like pus like lesion lah, dia nampak putih-putih. So dia ada macam nanas sikit-sikit lah, but sometimes it's just debris only. Debris like white debris. Tapi others presentation like yalah sore throat semua kan, bengkak, and then so that we diagnose as tonsillitis.
I see. Okay, doctor, sorry, tapi before we carry on with the indications ni, can you explain like what is the difference between sore throat yang affect tonsils dengan sore throat biasa? Like how would a patient know the difference?
Dia kalau sore throat biasa ni, easy to relieve and then patient doesn't need antibiotics. Usually if patient with tonsillitis and then the fever is high grade fever, then the pain is quite very intense pain, the patient cannot eat, and then and it rarely can resolve on its own. I mean, patient need to go to search for medication like antibiotics or like the proper treatment lah for the tonsillitis. So kalau sore throat biasa ni, biasa dia sakit-sakit tekak sikit ni, makan apa strepsil whatever then resolve.
Yeah, it's okay.
So and then the other things of the infection of the tonsil is peritonsillar abscess. So peritonsillar abscess basically is the infection is coming from the tonsils, but there is accumulation of pus at the tonsillar bed. So I mean it's more worse lah. I mean the condition is more worse lah. So patient biasa dia akan when we look at the throat, one side of the tonsil already like bulging out and it push the uvula. You know uvula the center structure, so it already push towards to the other side. So in this condition, biasanya kita tak terus buat tonsillectomy lah. And sometimes patient tak pernah pun sakit tekak and suddenly develop that kind of infection. So apa yang kita buat, we will treat the infection first. We will put a needle, aspirate the pus or make an incision, drain the pus, give antibiotics, and then later lah, if the patient has recurrence, then usually that's the indicated for the tonsillectomy. So maksudnya dia kena 2 kali lah. Kalau ikut buku lah kena 2 kali. Kena 2 kali. Ataupun patient has one episode of this peritonsillar abscess with recurrent sore throat, recurrent normal tonsillitis. Then that one also kita consider for tonsillectomy.
I see. Okay, doctor, since we have each one pair of tonsils kan, so usually
Yeah.
if one infected tonsil, will it affect another atau it can be just one, or it depends on the
Dia,
situation? Macam mana?
kalau acute tonsillitis biasanya dia kena both side, bilateral.
I see.
Tapi kalau peritonsillar abscess ni biasanya one side lah, one side more prominent kan. I mean the
Right.
pus is at one side only.
Hmm.
So
Okay, alright. Okay, let's take a look at the next one. Sleep apnea. Oh, apa kena mengena tonsils dengan sleep apnea? What's the relation between the two?
so basically sleep apnea patient presented with snoring and intermittent stop breathing during sleep, like 8 hours
Yeah.
sleep. Actually, by definition, in 8 hours sleep, patient has stopped breathing like sometimes about up to 30 times. So bila dia stop breathing ni, dia akan, I mean, the oxygen or reduce oxygen in the
Right.
body kan. So one of the cause, actually to cause sleep apnea, there are a few factors lah. Like when the tonsil is enlarged, the adenoid,
Yeah.
which is tonsil behind the nose, is also enlarged, and sometimes the patient is obese with a
Yeah.
short neck. So all those contribute to the sleep apnea. So what part of the operation of the sleep apnea is to remove the tonsil as well. Actually, sleep apnea also common in children. I mean, bukan common in children lah. I mean, if the children have this type of problems, sleep apnea, so tonsillectomy can, we can say that 90% can cure the child lah. Something like that. Inshallah.
Okay.
Inshallah.
Since we are on the subject of age, usually tonsillitis ni happens among children ataupun adults?
Tonsillitis, dia actually dua-dua pun ada pun. Dua-dua pun ada. Children also can have and also adult.
I see. Does that depend on the habits ke? Maybe suka makan pedas ke, or any particular factors that affect a person's risk of getting tonsillitis? Or it's
Actually,
just
dia
one of
tak
those
sangat
random
lah.
things?
I mean, it's not documented anything which contribute to the infection.
I see. Okay.
Tak tahu lah. By chance lah usually. Sometimes it can run. Nak kata run in the
Random, one of those
family.
things.
Sometimes it can run in the family lah. Boleh. That one is by history actually. But theoretically it's not. Theoretically it's not. Kita pun tak tahu kenapa. Why certain person can easily to get tonsillitis, the other person not really getting that problem. So,
but it's not infectious in any way. Katalah somebody with tonsillitis eats with a spoon and then another person comes and uses the same spoon.
Tak adalah. Unless the tonsillitis is because of the viral infection lah. But the virus itself can transmit lah. But usually it's not lah. It's not.
I see. Okay. All right. So let's move on. So sleep apnea is one of the reasons also for tonsillitis. Okay. This is tonsil cancer.
Tonsillectomy. Tonsil cancer. So in cases like this, usually if got tonsil cancer, the common is like carcinoma lah, carcinoma of the tonsil. That one we don't do tonsillectomy. There's a bigger operation for that. But for lymphoma, I mean, when we look at the patient's throat, one huge tonsil which we have suspicious of lymphoma, then we have to take it out and send for biopsy to get the proper HPE result. I mean, proper diagnosis. Because lymphoma basically is not only tonsillectomy will cure the thing. Maybe later patient need to do chemo, but the tonsillectomy meant to get the diagnosis.
Right. I see. Actually, I
sangkut. Tak sangkut. Sangkut.
never heard of tonsils. Hello?
Hello.
Okay, we're back. Okay. Sorry about just now, ladies and gentlemen. It seems that we have a bit of a connection problem. But we're okay now. We're back live. Okay. So doctor, yeah, we were talking about tonsil cancer, yes? So this is I was gonna ask you, how common is tonsil cancer in your experience? Have you seen a lot of these cases?
Mm,
It's not something
when
that you hear of.
when I work in government last time, quite a number lah. Not that frequent. Not like tonsillitis. Tonsillitis is very common, but tonsil
Yeah.
cancer rarely we see. But sometimes we do have that type of patients.
Yeah. Okay, all right. So let's take a look at what's next. Other problems. Oh, okay. All right,
Other
doctor, maybe you
problem,
want to explain?
other problems like tonsillosis. Tonsillosis is it's like a tonsil. It's a tonsillar stone actually. When you look at the throat, sometimes there's no infection, no pain, but there is a debris, the white debris trapped in the tonsillar crypts,
Yeah.
and later it will form the tonsil stones. But actually, once actually this one also common in patients with chronic tonsillitis.
Mm.
So yeah, but sometimes this tonsil stone we can hook it out and remove, but actually there's a lot more inside. So
Mm.
some patients will feel like very uncomfortable because it's quite smelly when cough out and then spit out the small white debris and very smelly. So sometimes patient keen to remove the tonsil because we can only get rid of this by removing the tonsil if it keep
Yeah.
on recurring. Yeah.
This is excess calcium.
Because of the trap materials, the mucus, dead cells, bacteria
Oh,
all
I see.
inside, so it forms stones.
Yeah.
So
Okay. What's the picture at the bottom too? Sorry, we just take a look. So
that
these
one is
two, the one on top is
the one on top
macam
is the
like a
small,
bottom.
little tonsil stone, but the down part is when the tonsil stone become a lot.
Macam stalactites.
Huh?
They look like stalactites just hanging off the
Yeah.
wall of the mouth. Okay, all right. So doctor, with all these problems, I'm sure there are a few treatment options, but since today we are talking about tonsillectomy, okay? So perhaps you can share with us what is tonsillectomy and what does it entail procedure? Dia?
Okay. Basically, tonsillectomy is a surgical procedure where we remove both palatine tonsil. Palatine tonsil means the tonsil that we can see, I mean, in our mouth.
Yeah.
So, okay,
Removing in what sense? Oh, okay. That one later we can see the process, right?
we remove lah.
Mm.
So actually, it's a common procedure. Even when we like us ENT doctors, once we join ENT, this is the first thing that we need to learn. So in government, I know in government side, usually MO will do. Only
Oh, I
the
see.
difficult case, the specialist will come in. But it's a
So
common
is
procedure.
that
That's why
common?
because it's
I
very
see.
like I think almost every week there'll be a case of tonsillectomy, and sometimes the waiting time also up to 3-4 months, even sometimes 6 months to get the tonsil removed.
Yeah. So if there is an opportunity, then better go to private practice. Macam
Yeah,
pergi
yes,
Asia Hospital Cheras and see you lah in this sense to get
inshallah.
this up.
Okay.
Okay, doctor. In terms of apa ni, is it an outpatient procedure or you have to be admitted? But when you say it sounds like quite an easy or straightforward surgery.
Uh, it's not really straightforward, but it's important surgery lah because there are too many cases. Is it? So usually we
Yeah.
do with patient need admission. Usually patient need admission lah, but the
Oh,
certain
I see.
area also did as a daycare. But because we after the tonsillectomy, we have to observe the patient like 24 hours to be safe lah. To be safe, I mean to observe for bleeding, anything happen can like
Mm.
we can attend the patient immediately. So
Yeah, yeah.
it, uh, it's more comfortable for the doctors and the patient.
Right.
If the patient is getting admitted for like 24 hours.
Oh, at least one day lah, yeah?
At least one day, yeah. Usually it's one day, like usually one day is adequate.
Okay. And when you say surgery, is that like cutting up with manual tools ataupun is that using laser these days?
Actually, there's a few techniques, few instruments. Basically, the technique is about the same. So, definitely we need to remove because the tonsils is it's like a bulge which a lump attached to the wall as we saw from the previous picture. So basically, we have to detach the tonsil from the attachment side. So we can use nowadays a lot of instrument like ablative radio frequency, but maybe it can like shorten the duration. It depends on the individual, depends on the patient's condition also, and also that yeah, sometimes I think the pain and the rates the complication of hemorrhage doesn't make any difference. So
some serious complications of hemorrhage.
you can use any instrument you like as comfortable to the doctors.
Okay. What about your recommendation?
It depends on the availability of the instruments, but you use cold instrument like the traditional technique also adequate enough.
Okay, so this is done under general anesthetic, doctor?
Yeah, definitely. Under general anesthetic, and then we have to open the mouth using if you look at the picture, use a mouth gag. I mean, we need to open the mouth because patient is now is unconscious. So open the mouth, then we operate through the mouth. We remove the tonsil through the mouth.
I see. That's quite deep inside.
Not so lah. I mean, manageable lah. Not too deep. Because
doctor, and you've done this so many times, I suppose. From layman punya point of view, it does look very deep and not comfortable.
Yeah, the surgeon has to sit at the top of above the patient's head, at the edge of the bed.
After tonsillectomy, is there anything that needs to be sewn up? Are there any stitches? Any packer?
No need to stitch because usually we just after we remove the tonsil, then we just leave the wound bare, just like that. Just make sure that no bleeding. So just leave like that. So the patient like having a big ulcer at the side of the throat. So that's why the operation of tonsillectomy quite painful, but it's bearable.
Okay, all right. So let's take a look. Is there anything else that you would like to explain? Oh, what is this adenoid?
Adenodectomy. Actually, adenodectomy is to remove the adenoid, which we commonly we commonly do this operation together with the tonsil in children. Because sometimes the tonsil is big and the adenoid also big. So at the same sitting, we just we scrape the adenoid out.
Adenoid has no function?
Same. It's a lymphoid. But the problem is when the patient is having adenoid, patient also have like nose block, snoring. That's why
is it resdung?
Together. Pardon?
Is it resdung?
Tak juga. Resdung is allergy rhinitis. That one is different topic. Sometimes even adenoid also, because when the size is big, sometimes patient like frequent running nose pun ada juga lah. It do contribute. And tapi dia block nose and snoring lah, basically snoring and.
See. Doctor, adenoid dengan tonsillitis too, because I mean apparently since they're in the same slide, how is it connected? Because of the location of the adenoid and the tonsils?
Sebab dia actually lymphoid tissue dekat our throat ni. Satu tonsil, adenoid, tubal tonsil, lingual tonsil all form a like Walden's ring. Dia memang Dia ada lah kat situ. Dan yang biasa yang kita remove kalau dia besar is this palatine tonsil, yang tonsil biasa tu dengan yang adenoid tu.
Right.
Dia tempat dia dekat-dekat je, dekat-dekat. So
okay, so might as well lah remove. So you were saying that adenoid ni among children, a lot of them.
children dia lebih common lah. Adult ni sebab by nature actually as the child getting bigger, kadang-kadang tu dia punya adenoid tu dia jadi flatten, jadi hilang, dia macam doesn't make any problem lah. Doesn't cause any problem.
Okay.
Tapi kalau dia besar,
there's nothing to lose.
So
it's okay to live without an adenoid.
It's okay. Even if we remove the adenoid pun kita tak adalah boleh remove in total. Still got some lymphoid tissue left. Cuma kita like flatten up you get the space lah for the air untuk breathing. Sebab yang case of adenoid,
the purpose of adenoid is it for defense as well macam tonsils? The purpose of adenoid.
Function dia sama sebab dia lymphoid tissue.
Okay.
Tapi
alright.
Dia tak ada pun tak ada masalah. Sebab dia banyak lagi kan. We have lymph node, thousands of lymph node in our body, so I think shouldn't be a problem.
Okay. Okay, so what's next? Post tonsillectomy care. Oh, okay. This one I know I've heard of ice cream before. That's the only thing I know about tonsillectomy, that in order to heal you eat ice cream because you need cooling down. Okay, maybe doctor you can explain in detail.
Actually after the tonsillectomy, for the post tonsillectomy care lah. After the tonsillectomy, one thing we need to watch out for the bleeding in case there's any bleeding. But if everything fine, then after 4 hours after surgery, you already allow the patient to take orally. Start with drink plain water and then take, if no vomiting, then can start eating ice cream, jelly, all the soft diet, soft and cold. And then later,
doesn't it hurt? But when you swallow, doesn't it hurt?
It will be painful a bit. It depends. It's a bit painful lah. Not to say that painless. It's not a painless operation, frankly speaking. The second, imagine if you have ulcer in the throat. Bulan tu memang dia sakit lah kan.
Yalah. Pedih.
Tapi boleh lah sebab even children pun okay. Certain children tu nampak macam okay. Sometimes after post operation day 1 already take burger certain patient lah. It depends. Tapi actually we more advise for the soft diet first lah.
Okay. Alright. So is there anything that you should not consume just after tonsillectomy?
After tonsillectomy, I mean hot drinks, all the hot food lah, yang makanan panas, and then all the hot like biscuits, to try to avoid sour things because it cause pain to the ulcer, to the wound. Daripada tu actually tak ada apa sangat pun, tak ada pantang. To me, not much things to pantang lah, you know. So the lower picture tu actually just to show how the throat looks like after the operation. Because when patient go back, like after 24 hours, we will discharge the patient. So sometimes patient see, there's a lot of white in the throat, so dia dah takut macam is that infected ke apa kan, infection ke apa. Tapi sebenarnya tak, sebenarnya that's the nature of the post tonsillectomy wound lah. Because after we remove the tonsil, become macam fresh wound kan, so at the throat cavity, so dia akan jadi slough lah, dia akan naik white slough. So that one is normal. So after a while ni bila dah makan, sebab tu kita advise patient to eat. We advise patient to eat. Jangan macam takut, tak nak makan lembut aja for the whole 2 weeks. Tak lah. Actually we not advise for that. Dia bagus kalau dia chewing, dia mengunyah, dia bercakap sikit tapi not too much lah kan.
Yes.
Macam berkunyah-kunyah, so that the exercise the throat and I mean healing better lah.
Okay, alright. So that's about post tonsillectomy care. Let's see what's next. What is this about? Post operative pain?
Post operating, and then usually we will prescribe patient with antibiotics, throat spray to reduce the pain. So certain patient don't like to take painkiller. I have few patients lah, come they didn't take painkiller. Cakap, oh, why don't you take painkiller? Kata, tak nak, ada side effect lah, apalah. Tapi actually, painkiller side effects, not much lah. I mean, unless you take that painkiller for long duration, like few months, then kidney problem lah, apa kan. So, painkiller is necessary for post tonsillectomy patient lah. That's why I advise take the painkiller so that easy for you to eat, so that the healing better. It will heal the wound better. And then
on average, doctor, on average, how long does it take for someone to heal completely from post tonsillectomy?
For adult, I would say 2 weeks. The duration is 2 weeks. Usually after 2 weeks, patient feel much better, can eat anything after 2 weeks. But if you look at the throat, sometimes the wound is still there, like another 5-10%, the wound still got some fresh wound. But the most important thing is no more pain. So patient can go to work. So for me, for the adult, usually it's 2 weeks lah. For children, usually a bit earlier. Because children sometimes macam and the magic sikit lah children. Kadang-kadang tu tak sakit sangat pun. So
higher threshold.
Don't know lah. They already can pay around after the tonsillectomy. Tapi I always want the patient lah. At day 5, day 6, day 7, sometimes the pain very peak. Like sometimes they cannot sleep at night, something like that. So sebab the pain is disturbing. Tapi usually it's temporary only, and after that it's slowly getting better. Usually it's like that.
Is there any way for the macam tips to lessen the pain? Maybe a certain position of the head when you sleep. Is there anything like that, or it's just completely relying on painkillers?
Biasanya rely on painkillers. Lepas tu kena sebab biasanya memang macam kita advise patient to eat kan. Tapi kadang tu patient sakit, makan pun sakit cakap. Tapi slowly lah, you have to eat. You have to drink a lot. Tapi but the thing will slowly resolve. InsyaAllah. Biasanya okay insyaAllah.
Okay.
Dia kena bertahan sikit.
Okay, let's see. Is this the last slide? Post-operative plan? Pain. Okay, let's see after this. Oh, okay. I'll let you.
Ini dia lebih pada repetition je tu. Dia
yes, okay. This is the one. Okay, since it's a routine surgery, but of course any surgery comes with complications, like as I understand. Okay, so what are the complications that may happen? And why? I mean, in what circumstance?
Okay, complication, usually we divide the complication is during the operation and after the operation. During operation, sometimes a bit difficult in patient with small mouth. Sometimes, difficult to open because we need to open the mouth wide. And the other thing is like TMJ dislocation, the jaw kan, kita panggil apa? Temporomandibular joint. Sometimes can do like.
I thought you were talking about TMJ. Okay, never mind.
TMJ. No, the TMJ Johor.
So nothing to do with royalty, yeah? Okay.
Tak ada. Ada complication like TMJ ni lah, dislocation lah. Tapi itu biasanya kadang kalau patient tu memang dia dah ada problem of the ni lah, TMJ dia easy to dislocate. Tapi bila kita nak buat, then we have to careful a bit lah, not to open too wide the mouth, so that to prevent the joint from dislocate. Lain daripada tu, of course ada bleeding kan, tapi biasanya okay lah, insyaAllah lah. Biasanya okay, the risk of bleeding we always worry, and we always careful lah, not prevent it from happen.
Right.
lain tak ada apa. Sometimes ada juga lah kes-kes, not my case, my colleague's case, like gigi dia tercabut bila kita letak mouth gag, ada jugalah. Sebab tu before the operation kalau ada apa macam yang dah goyang, dah longgar tu, we have to, I mean the patient has to tell lah. So that kita jaga sikit lah so that the gigi tu tak tercabut.
Yeah. Okay. So it's more those kind of complications lah. But I think earlier earlier during the talk you mentioned something about hemorrhage.
Yeah, hemorrhage. During the operation, usually if the bleeding, definitely there will be bleeding there. So we cauterize, stop the bleeder, and then we wait for a while, like 10-15 minutes to make sure that there's no more bleeding and then the operation is over. So, but we have always ask patient to aware of if any bleeding post-operatively, like while patient in the ward, patient spit out blood. If a bit, then usually doesn't matter. It's okay. But if spit out a lot of blood continuously, and then you scared that there's a bleeding there. So that's why we keep the patient in the ward for 24 hours for observation.
Yeah, to monitor.
And then also the bleeding, sometimes the bleeding not happen in the ward, but after the patient discharged, like day 4, day 5 also still can happen. I always tell the patient beforehand, have to careful. If any bleeding, then you have to come back to the hospital, something like that. But it rarely happen lah, but you have to
just in case lah.
Just in case to warn them lah.
Yeah, of course, these are the things that every patient should know lah in case they are going or have just done tonsillectomy. Okay, all right. Yeah, let's take a look at the next slide. What's this about? Post tonsillectomy, long-term consequences. Okay, what does this mean? The results of a tonsillectomy.
Yeah, because the common patient who came because of recurrent infection, so there are a lot of absentees during schools and also for the work. So
yeah,
so I mean it's better for them lah, so that they reduction in the school absence lah. And then also and some patient also have like previously have tonsillitis, but after a while no more tonsillitis, no more infection, then so we are not considered for tonsillectomy for those type of patients. Means it's already resolved maybe by their own immune system mechanism, so tak perlu buat operation apa lah.
Doctor, someone who has just done tonsillitis, can they tell the difference between having tonsils and then once the tonsils are removed, they feel like a slight difference, maybe lighter, or it's just something that's not there? Is it possible for them to feel a difference?
One thing which I had a comment, patients comment that after the tonsillectomy, no more fever. Very rarely to get fever. That's good things lah. And then the other things are like the eating, especially in children. Certain children also have more appetite, so eat more. And then it depends the problem before the operation done. Like if the tonsil too big, sometimes they have like a bit difficulty to swallow, a bit difficulty to breathe. Yeah, so all that will be resolved.
That's good. Okay, all right. So that was tonsillectomy. Yeah, I think that is the end of the slide if I'm not mistaken.
And certain patients sometimes feel tightness. Tu kadang-kadang tu ada jugalah. Dia rasa macam tight sikit, tekak kan, for the because of the scar apa. Tapi usually that one not much problem lah, not much problem.
Okay, all right. Well, thank you very much, doctor, for all the explanation. I'm just wondering if there's another slide. Betul, tak ada. Okay, so thank you again for making time. So now we have a bit of time, so we're going to take a look at questions from the public. Okay, we've got some some people saying hi to you. Hi, Dr. Azlina, from Muhammad Nasrul, from Mr. Barjish. Okay, Muhammad Nasrul is asking, my cousin did tonsillectomy together with ear surgery. Why?
Okay. So basically because sometimes tonsillitis, I mean, tonsil enlargement can cause a ear problem, especially in children. That's why when the patient came with the tonsil adenoid, huge adenoid and tonsil, so we have to check the ear as well. So patient can have like otitis media with effusion, means the water retained in the middle ear, so that patient has less hearing. Sometimes the mother
Oh.
didn't realize lah. Certain parents realize, but certain parents didn't realize. The patient actually having reduced hearing. So actually it's quite, not to say common, but we have to look at it lah. Because usually we do together with the myringotomy and grommet. I mean, we poke the eardrum, remove the water, and put a grommet inside to for the reduced hearing problem.
Okay, but that's got nothing to do with tonsils lah. That is just that it's connected because, well, ENT is.
Usually it's more connected to the adenoid hypertrophy, but usually because it's together, you see. So huge adenoid, huge tonsil, we have to look at the ear as well. Cannot just like ignore the ear.
Okay, I hope that answers your question, Mr. Muhammad Nasrul. Okay, Zalina Zakaria is, first of all, she says, my doctor ENT, so I suppose she's one of your patients lah agaknya. Okay, her question is, kalau kanak-kanak umur 2 tahun, boleh buat operation tak, doktor? What's the youngest patient? Is there a minimum age for tonsillectomy?
There is no minimum age, but the problem usually, if above 2 years, right, to be safe, but 3 years is okay. I mean, because sometimes children ni kita I mean post-op sebab after the operation pain to swallow, so we also scared that the patient will get dehydrated, something like that. And then if any bleeding, sometimes we very difficult to check the throat. Benda tu yang jadi complicated sikit lah. Tapi kalau benda tu really you need to do, you have to do juga. Even 1 year plus, 2 years also, we still need to do. Tapi if can avoid, we will wait until the child a bit bigger. Then easy for the parents, easy for the doctors also.
Okay, so we have another question here from Miss Nabila Rahim. But first, Lim Wonsia says, hi, Dr. Azlina. Okay, again, Miss Nabila Rahim is asking, hi, Doc, can tonsil regrow again after surgery?
Usually no, but sometimes the small tissue of the tonsils left at the tonsillar base, because tonsils actually is a capsulated structure. So once we remove it, usually we manage to remove it all. But if there's some cells left, it can grow a bit, but a bit usually it's not big. Usually it's not big as like the previous, I mean the before, usually just a small.
So it won't be a complete tonsil lah. It's not like a new tonsil.
Tapi biasa tak ada masalah sangat lah. Tak ada masalah sangat biasanya.
Okay, all right. I think that's all the questions that we have, and that's all the time that we have for today. So thank you very much, Dr. Azlina Saaban from Columbia Asia Hospital, Cheras. She's the consultant ENT surgeon. So thank you for your time, doctor.
Yeah, thank you very much.
We'll see each other again. Okay, bye everyone. Thank you for being with us. Hope that was helpful. Bye.